Hello and welcome to the National Road Safety Partnership Program webinar, Fleet Crash and Infringement Statistics and Risk Management Strategies. My name is Jerome Karslick and I'm the Principal Director of the National Road Safety Partnership Program and its many activities. Mark, would you mind just shooting across the next slide so they can see my picture, please? Obviously, you also see me in the corner, there I am. To find out more, please go ahead and visit the NRSP website, register for our newsletter, or even better, follow us on social media such as our LinkedIn page. We try and keep everyone up to date, and we'd love to share what we're creating and doing over time. Today's session is going to go for approximately 60 minutes with plenty of time for discussion throughout. We're going to be recording the session today and it'll be shared on the NRSP website along with the PDF of the slide deck as well. We're using Zoom as our new sort of platform for our webinar. It's a bit of a learning experience for us as well. We have 40 minutes focusing on Mark's presentation and around 20 minutes for questions. So Mark's keen to take them during if the right sort of ones pop up. But we have two specific question points as we go along. Next slide, please, Mark. We'd love to have your input and to make the webinar as interactive as possible. So if you can go ahead and please enter any of your questions into the Q&A box sitting down the bottom there. And as you're typing them in, we'll answer them as you go along through the question. I must admit, I've got to update that picture there, Mark, next time I do a webinar. And we'll answer them as we go along. Some of them might be have to be held through to later in the presentation, so chuck them in, grab them when Mark's sort of touching that sort of point. I mentioned Mark a few times. Next slide. Mark is our presenter today. He is a wealth of knowledge. He's manager of fleet operations at Uniting Care Queensland, and he's worked there for an incredibly long time, 26 years. That's a few long service leave sessions, I must admit, Mark, in a range of roles, including maintenance, food services, aged care administration, business, and now he's really been leading the fleet operations for the last 14 years. He has a huge fleet, and just from a personal note, he's been part of the NRSP steering committee since its inception. He's been an incredible contributor to the NRSP, and since its inception moving forward, and always willing to share. So welcome to you, Mark.
Thank you, Jerome. And thank you everyone for coming into today's session and just seeing the journey that we've been through at Uniting Care, the road safety journey. Today in my presentation, I want to take you through Uniting Care's road safety journey. Starting at the beginning, I want to paint the picture of how this organisation was founded and how it's grown to be one of the largest not-for-profit aged and community services in Australia. I want to demonstrate how this organisation has worked to create a culture of road safety through education of drivers and through the procurement and maintenance of safe vehicles. At the end, I also want to talk about how we as an organisation are managing the risks of operating in a new environment under the impacts and restrictions of COVID-19 when it comes to the pressures on our drivers and with the people they are sharing the roads with. So, and really, this front slide at the beginning and so forth shows the journey as it is really. And the top picture there is of our first nurse, and the bottom picture is a current nurse delivering care into the home. So as you can see, there's been a big change in the motor vehicle and the uniforms.
What is that vehicle, by the way, Mark?
Sorry?
What is that first vehicle, by the way?
It's a very, very early model Holden, but I can't tell you what model it is, Jerome. I will have to find out.
Awesome, thanks.
I do like the phone numbers, though. So just to give you a little bit of a background, Uniting Care story originated from one person's desire in 1953 to serve Queenslanders and improve the lives of those in need of care. This person, the Reverend Arthur Preston, along with our first blue nurse, Olive Smith, started delivering care in the west end of Brisbane. And in those early days, before our first fleet vehicle, care was delivered by public transport when trams ran through the streets of Brisbane. This focus on individuals has helped Uniting Care become one of Queensland's largest and most trusted providers of in-home care, residential aged care, disability services, independent and supported retirement living, and allied health services. Let's just have a look at our history then. So we were established in 1953. We've got 4,200 residential aged care beds. We carry out 3 million visits to Queenslanders each year. So that's 3 million visits to approximately 60,000 individuals. Fleet was established in 2006, we have currently in the fleet 2,300 Uniting Care fleet vehicles across the Northern Territory and Queensland. We've also got over 1,000 grey fleet drivers, which is a complete risk on its own, but managed exactly the same as our fleet vehicles when it comes to driver safety. Our vehicles, the fleet vehicles, travel over 40 million kilometres annually. Sorry, I'll correct myself there. That's our fleet vehicles and our grey fleet vehicles collectively travel 40 million kilometres. In addition, we also manage 650 vehicles across Victoria and Tasmania for Uniting down there. Again, a couple of pictures there just of a current nurse and a group of nurses back in the 1950s.
Just quickly, Mark, so grey fleet vehicles, what's the definition of them in case people listening on our webinar don't really understand the term grey, because it's not older drivers, is it?
No, it's not. Grey fleet drivers is where a person is paid an allowance to use their own vehicle. So they supply the vehicle, they deliver the care in the vehicle, but they are paid a kilometre allowance for that vehicle to cover all of the costs on the vehicle. When it comes to a grey fleet vehicle, from the moment a person steps into that vehicle and is paid an allowance, that vehicle must be treated as a workplace. Hence, it needs to be treated, or the controls and the mechanisms in place need to be the same as that of a fleet vehicle.
So what you're saying there is you still have a duty of care for that person?
We have a duty of care for that person, but a duty of care to make sure that that person is maintaining and operating that vehicle how they should, as if they're in a workplace. So moving on. So what are the hallmarks of our driver safety program? And this is really the basis of the program, which will change, will need to be reset from time to time. But the basis of our program is in-house driver safety awareness training, including tailored training programs for bus and truck fleet drivers and identified at-risk drivers. We have driver evaluations and rectification interventions. We have non-conformance training and assessment packages. I wanted to bundle those three together before I speak to them because they are the core of our driver education. And there is nothing more powerful than getting a group of people in a room or having a one-on-one with a driver to talk about driver safety and road safety. And the engagement that generates when you have that group of people together. So you can put any number of fact sheets out, any number of toolbox talks, and whatever other mechanism we use to enforce, or sorry, to help to remind people about road safety. But there's nothing more empowering than getting people together talking about it. So we have our road safety and fuel efficient driver e-learning programs. We have data analysis of all elements of our fleet operations. We actually built our first RPA, or robotic process analysis, of our complete fleet data set to identify our fleet efficiencies, but also where we may have drivers that might be driving vehicles a little bit too hard. And you'll pick that up through things like increased maintenance costs, increased fuel, high fuel economy, etc.
How big an issue is it? Like, do you think many fleet people actually realise safer driving, the correlation with reduced fuel use and maintenance? Is that a real big lever, do you find?
I'm not sure that it is, to be honest with you. I think there are drivers out there that do understand it and drive efficiently. And look, I'm a bit of an observer, I suppose, of human behaviour, and I have followed or been on the road with some of our drivers and seen the way they drive. And you can pick the ones that, and fortunately they're the ones I've been following, but you pick them that they are actually driving quite efficiently. You see them rolling into traffic lights. You see when they take off that they gradually take off and so forth. You don't see over acceleration or speeding around corners and so forth. So there are those out there, I think, that they're very safe drivers, and by being very safe drivers, they are getting fantastic fuel economy, and you can pick that in the figures. And occasionally you get a couple of them that'll just jump out and go, yeah, maybe I'll need to go back to the manager on these ones and just have a chat to them. But that RPA data analysis is actually sent automatically to our cluster managers. And that's the beauty of robotics, is that you can actually program the outputs to go directly to the people who need to action them. We also use frequent communication through a range of mediums to actively promote fleet safety and sustainability. And the image at the bottom there is actually our email footer, but it's also the basis of our poster campaign, and as well as our screensaver. Sorry, I'll just move on. So, and I'm going to, sorry, I'll just go back. I am going to touch on a lot of this stuff later on. You'll see more examples and so forth of what we do.
And I will also just jump in that that's our latest case study we've done, which expanding on what Mark did for us basically a couple of years ago now. So this is a bit of an updated journey. You can sort of see where they've come from and have a bit of a look in there as well. And I will just quickly say one comment that really resonated from years ago when you did one with us, Mark, was when you made a closing comment saying if you can create a courteous workforce, you're around 70% of the way there with your driving road safety.
Absolutely correct. Yeah, there's if you've got a courteous, if your fleet is made up of courteous drivers, you'll not only have a very safe fleet, but you'll also be driving sustainably. So you'll be getting the best out of your vehicles and so forth. So, and I've got to say, your drivers will be a lot happier at the end of the day, less frustrated and so forth. So, yeah, road courtesy is the basis of just about every fleet safety program, or should be.
Now we can hear you achieve it. Great, Mark.
So what is influencing driver and vehicle safety? And I thought I'd just put this slide together just to go through some of the influences, I suppose, of safe driving these days. And some of these are the things that are impacting our drivers, but some of the things that are also benefiting our drivers. So the continuing development of safer and more environmentally sustainable vehicles, the evolution, and that's a positive for us. The safer vehicles are certainly protecting our drivers if they are unfortunately in a crash, but they are also helping to prevent crashes. The evolution of and reliance on mobile technology, which while it's an innovation, also presents one of the greatest risks on the road today. The emergence of grey fleet as a risk that needs the same management treatment as fleet vehicles. And probably the word emergence is the wrong word. It's been there for a long time, but I think by the word emergence, I mean now it is becoming more of a focus and should be a focus for all fleets. Jerome, are you getting any noise feedback?
No.
Okay. Significant changes in the type and volume of community services being delivered, including NDIS, aged care and hospital in the home. The changes in duty of care legislation or interpretation of duty of care. And this is one that I'm constantly worried about, is that what we are doing is addressing our duty of care to our drivers. and it's something that we are always thinking about, is have we addressed the duty of care of our drivers? The changing environmental conditions through increased risk of fire, flood and storms, and that hasn't been more obvious than in the last couple of years. The increased risks on the road through congestion and intolerance. Again, the word intolerance there could not be more evident than it is today under COVID-19. And the increasing pressures to improve productivity. So these are all factors that are influencing driver and vehicle safety today. Yes, John.
And like, just a question, like when you say productivity, I think there's another interesting angle that a lot of people just do not realise around your workforce. Like when you see your nurses out on the road, they're very altruistic sort of people. They're a very specific sort of person who goes into that sort of area. So how do you balance working with people who love focused on outward care and supporting the community and helping the people they're reaching out with, to balance them actually being safe on the road and realising they can only do so much because they're not Wonder Woman would be a better one, I think.
Yes, and you did right, Jerome. Our staff are altruistic. They are people who care about the clients that they are providing the care to. That's why they take up this this career. And we have staff that are providing care to some of the most disadvantaged people in the community, some people who are going through significant health issues. And, you know, some of those health issues may not recover from, or those health issues that may impact them and their partner. So when a staff person is delivering that care and is doing it to a timetable, that can create pressures through the day and towards the end of the day. So we need to be able to provide our staff with the mechanisms to be able to adapt and change their day so that they are not putting themselves at risk. And that's being able to provide or contact their manager or whoever's scheduling the task to say, look, I've been held up. Can you make some changes to for my clients for the rest of the day so that I can both catch up, but also not be under the pressure on the road. So it's a very, very good point. And it's exactly the same point that should be applied to people who are not in the care environment. So your Salesforce people who are on the road, or people who are providing services in houses and things like that, who have made commitments to people further down the day and so forth. Because the last thing you want them to do is to be under pressure to commit an offence on the road or put pressure on themselves where they may have a crash or impact on, or have a crash that impacts not them, but other people.
Great answer.
So just looking at how we achieved or how we have developed and continued to develop our road safety strategy and resources. And without stakeholder engagement, you wouldn't achieve the outcome that you're after. Internally, we have quite a few stakeholders, as you can see. And the actual photo that you're seeing there, by the way, is our truck drivers for Lifeline. And these guys and ladies, sorry, they run the operations that provide the stock for the thrift shops, the Lifeline thrift shops. And they also, and the money from those thrift shops goes to supporting the Lifeline call centres, which, as you know by the stories in the press and so forth, are worked harder than ever at the moment under COVID-19. So our internal stakeholders are our fleet and grey fleet drivers. They're our primary stakeholders. They are the ones that we want safe on the road. Our cluster managers and general managers, their leadership team, the service managers, they are the people who we want to be promoting road safety with our drivers, and also helping our drivers to become better drivers through interventions and so forth. Our workplace health and safety people, learning and development, people and culture, probity and risk and compliance, all important to make sure that what we are doing is both compliant, but also meeting duty of care for our drivers and the people we serve. And I say the people we serve because a lot of our vehicles carry clients as passengers. So it's not just about our drivers, it's about our clients and our passengers. And of course, no safety campaign, no culture, no duty of care is possible without the buy-in and complete support of the executive leadership team and ultimately our board. And I can tell you now that I have that support. These are people who want our drivers to be safe on the road. So that's the internal stakeholders. I thought it would be very, very good though also to point out what the ecosystem looks like with regard to our stakeholders. Because not only have we got internal stakeholders, we've got external stakeholders. So what we've got is our organisational stakeholders just here. But if you have a look externally, these are all the people that I have consulted with, had done research with, who have supported us financially, who support us through our operations and so forth, through every day of the year, through the year. There's the researchers that I've worked with over the years, QUT, CARS-Q, Monash, currently got a project going with Swinburne University. Our corporate partners and insurance brokers. So we've got Suncorp who support our driver education program. We have Vero and Aon, our insurance brokers who, our broker and our underwriter who through risk management support our programs. Smartfleet, our FMO, without an effective database and system and the account management there, we wouldn't achieve what we achieve day by day. The peak bodies that we have associations with that we reach out to from time to time to support a new program or get information from or act as links to other vendors or groups. So AFMA, I've been a member of AFMA for just about as long as I've been a fleet manager, a great organisation. Of course, the National Road Safety Partnership Program, which provides so much information and support to hundreds of fleets Australia-wide, and is a fantastic organisation. I'd encourage anyone here to reach out to them through the website and look at all of the resources there. The RACQ in Queensland have been great supporters of Uniting Care over the years, both through providing driver education in the past and in their support in helping develop our campaigns. I am missing one from there, and I must actually commend them too, and that's FDT, Fleet Driver Training. Those are the guys who now deliver our driver training in Queensland. Brian and Craig are absolutely brilliant at the relationship they have with our drivers through the one-on-one interventions and the group training sessions, and now through webinar delivery of driver education under COVID-19. And of course, TMR, the transport authorities, the road safety authorities across Australia are absolutely brilliant in their campaigns and what they provide to us. I don't try and invent everything in our system. I reach into the transport authorities and promote their campaigns, but also use their resources that they make available. And of course, our vehicle procurement people. Toyota, and the leasing company TFM, but also Pickles Auctions. And some people might ask, well, hang on, why are you talking about Pickles and so forth? Road safety is not just about, well, it's very much about the driver, and its primary focus is on the driver, but it's also about the vehicle. It's about remarketing the vehicle at end of life and so forth. Because as a not-for-profit organisation, we need to be able to get the best outcome, that best whole of life operating cost out of our vehicles. So that's why it's very important that all of these guys are part of our complete operations.
It's I think key thing I take home from this is you don't do it alone. You have many different groups supporting you, and it gives you so many touch points to help you as part of your road safety journey.
Absolutely, Jerome. It's a great way to depict this as an ecosystem, because fleet management and driver safety it's not just one element. It's a whole lot of elements all coming together. And when you get that right, everything will work. You know, you'll get a good whole of life cost on your vehicle. So financially, you're sustainable. The environment, from an environmental perspective, you're sustainable. But more important than all of that, your drivers are safe in those vehicles, delivering the care on the road.
Right.
So the resources, and as I said earlier, I thought I'd just touch on today just a range of the different resources that we use. We have videos that we have developed, and new videos being developed at the moment by Fleet Strategy and Tim Roberts. We have posters that we've developed, so visual resources that stand out in a service when staff are in the service doing their notes or picking up cars or whatever. You'll see Workspace, which is our social media platform. And this is just, this is up in the Atherton Tableland, actually, at one of our services up there, where a staff member put together a notice board with NRSPP fact sheets, and our poster there. There's a range of resources there. That little cabinet is the key cabinet, where they come and pick up their car keys to take the fleet vehicle out. So they position it, and of course the COVID-19 hand wash front. so you know, that's just a great picture that shows that you don't need, you've got to use a range of mechanisms, I suppose, to get the message out. You'll see there that I've shared that 5 times with 5 different other work groups, and at that time 125 views. Now, that's not a huge number from my perspective. I'd love to see 600 there. But again, if there's 125 people there that are sharing that with 1 or 2 other people, then we are getting the message out there. You'll see here that this is some of the Queensland government's road safety campaign material that we've used. We promote Fatality Free Friday through Driver Safety Australia and so forth. We have our 2D animation videos. So we've got a whole range of products there that we access or source from different sources. Just move on now. And I think we are at questions, Jerome. Yes.
That's fantastic. Thanks, Mark. So I guess opening question I'll throw you. What is the biggest safety issue for you at the moment?
There are two safety issues at the moment. So one is a safety issue, and that is COVID-19. So COVID-19 is the biggest safety issue we have at the moment. And the reason I say that is that there are drivers now out on the road who are, shall I say, suffering from mental stress as a result of COVID-19. Drivers out there who may have had a partner who've lost a job. There are drivers out there, and I'm saying this, I'm saying this in 2 contexts, both our drivers and the drivers they are sharing the road with. So there are drivers out there that may have lost their job, may have had their hours reduced, maybe homeschooling or having to get try and squeeze homeschooling in while still carrying out their job. They may have elderly parents in an aged care facility or elderly parents living somewhere in the country that they cannot visit. They may have children that cannot get a job or may have lost their job. A whole range of factors. They may be people who love to socialise but now cannot socialise, and that is putting mental stress on them. And so that is our greatest risk, and that is why we're seeing an increase in road crashes at the moment. People doing stupid things, but people doing things because they've got other things on their mind. The other major factor that we continue to struggle with is communications. And I'll put this into context. If I was a fleet of 50 vehicles operating out of one car park every day, it would be a lot easier because I'd be getting the message to those drivers every day. But where you have 4,000 to 5,000 drivers spread from Thursday Island to the New South Wales border and west to Docker River on the West Australian border, the constant engagement with those drivers with regard to road safety is the biggest issue. And to be able to react quickly or reset quickly when something like COVID-19 comes along, and to get those drivers, the message to those drivers is the biggest challenge for us.
Yep.
So you see that in some of the material that we're putting, that I've got coming up.
I think it's interesting. I think that COVID-19 mental space is an overlooked distraction. I think everyone thinks a traditional distraction is the mobile phone, eating whilst driving, other things going on. Whereas I think this is something that's quite often overlooked. There's a great question here from Stuart. Did you encounter any internal resistance during the road safety journey? For example, from senior leaders, managers, drivers, and if so, how did you overcome that?
Look, I'm going to say only minor ones, and really they are just something new that we're introducing and having to explain why we are doing that. Generally, no, I won't say the word generally. All the time, I have the support of my management and the board. There is no question about that whatsoever. It's how we go about making sure that we get the changes in place. Now, if it is policy related, then obviously we need to go through stakeholder engagement and testing to make sure that that policy change is correct and is going to be supported, and then getting the executive sign off on that policy. So we do have processes to go through. But I'm going to use an example like the TIMS messaging. So that's SMS messaging to 4,600 devices that we have sent out. And I will just quickly pull up this morning's message right here. And there, I know you can't see them, and sorry, and so forth. But today's message: don't speed, take care when reversing, be attentive and careful approaching or driving through intersections. A UCQ road safety message. 4,600 of those went out this morning.
And that's before they start driving. So when they wake up, it's waiting for them when they're having their coffee.
Correct.
Or so you check your phone and you go, oh, isn't that a great way to start the day?
Exactly. Yeah. And in a few weeks' time, we're actually going to be moving one to Friday afternoon. So around about mid-afternoon, where people are winding back, and they may have to prevent them from, or to raise awareness and that travel home and so forth. But I bring that one up because there were those that questioned why we're sending an SMS message to people when we don't want them to be reading a message in the car. And that was people who were thinking, yes, they were thinking about it right in the correct way, But what they weren't thinking is, well, drivers shouldn't be actually looking at the message if they are driving. If we've educated them properly, then they shouldn't be looking at it. And if they're not getting a message from us, they would be getting a message from someone else anyway, at some stage while they were driving. So, so it was a matter of just explaining the arguments around that and also the benefits out of it. And I did get a question, what research has gone into this, and can you prove that this is going to be effective? And my reaction to that was, well, no, there's not, but I have discussed this with a number of people, and we will measure the success of this ourselves and be sharing it with others if we do see the success that we think we are going to get through reduced traffic infringements and reduced crashes. So why not lead the way with things? You don't need to wait for someone to do a research project on something, or to put together a thesis or whatever on something. Go ahead and just do it if you think it's safe to do so, and measure your outcomes.
Great words of wisdom. And I guess I think that answers Nikki's question, just in case. Nikki asked, how do you influence management leadership to reset their priorities and consider road safety?
It's a very, very good question, because quite often management have got a lot of things on their plate. They're worried about productivity, they're worried about the balance sheet and so forth. And for me as a fleet manager and someone that's absolutely passionate about road safety, I need to make sure that I have got the evidence and the detail to present to them as to why we need to make changes. As I will show in a moment, I have statistics coming out of my ears on our fleet, but also I have, I suppose, the support from externals as well, and that's our insurers that I'm talking about, who support anything that we put up. So it's just a matter of having courage, I suppose, to talk to anyone right up to board level and say, we have this problem. It's an evolving problem, or it's a current problem, or it's one that I think we're going to have down the track. We need to do this now to make sure that when that happens, or if it's happening now, our staff are safe on the road. And that's about also having the financial solution for that too. You know, sometimes you've got to spend money to save money. And it's about making sure that you've done your research, you've done your analysis, and you've got the money to support that particular project.
That's great. So a couple other two questions before we move on. Another one just follow up from Nikki, and I really like this one. I currently work in road safety, but previously worked in community services with older adults. In some services, staffs were not paid at all or not given sufficient time to travel between client jobs, causing them to hurry on the road. Thoughts?
Okay, so fortunately we do pay staff to travel between clients, so that's not something that we do. We do pay them, so yes, rest assured. And personally, I don't think that would be legal now. And the second part to that question, Jerome, was the rushing. Again, any organisation needs to have the mechanisms in place for staff to be able to talk up or to phone their manager to say they've been delayed. They need to have those mechanisms in place. And if you don't, then you are technically not addressing your duty of care to those drivers.
Great answer. And these two ones you're about to touch on, so I'll just give you some context. So these are from Lee and Lindy. Lee is COVID having a negative impact on driver safety? And the one from Lindy is, in addition to Lee's question, is COVID having a negative impact on driver safety? Be interested to know how has it affected the amount of non-conformance in driving traffic infringement. So I thought they're a great two to go in as you're about to dive into the next section, mate.
Terrific. Okay. So I'm sharing today with you my crash history, and I discussed this with Jerome, and do we or don't we? And I thought, well, no, let's throw it up there, because at the end of the day, there are reasons behind crashes and so forth, but we really needed to show the impact of COVID-19 on both traffic infringements and crashes. So this is our history going back 2.5 to 3 years, and I'm just you'll just see here. Oops, sorry, clicked the wrong button. This bar here and this bar here was lockdown in Queensland, services suspended. Now you'll look at that and go, well, hang on, why did you have so many crashes? The reality is that the majority of those crashes were because the cars were off the road. Managers were looking at damage that was on them and getting all of those minor repairs that was an insurance claim, getting those repaired. So there were buses there and so forth. A lot of those were reversing crashes or bollard crashes. There was a few third-party claims within there. Then we had the true lockdown here, where we only had 12. Most of those 12 were minor car park crashes. And to put that into context, we reverse out of 10,000 driveways every week. And that doesn't take into account the shopping centres and the facilities and so forth. So our statistics for reversing will be a lot higher than sorry.
That's all right.
Than others. Okay. Then we came into Queensland coming out of COVID and getting back to work. Now, the interesting one about this one is that those crashes there, within there are 7 serious crashes that involved hospitalisation and treatment of 8 staff people. Fortunately, all of those people have recovered, but 2 of them did have to be airlifted, and that's how serious the crashes were. Now, those crashes weren't all our fault. Yes, 2 or 3 of them were. But again, we put most of those crashes down to COVID-19, and they were intersection crashes where people just were not concentrating on the road or the task at hand. There were people going through intersections, just going straight through give way signs, failing to give right of way. There was one that went through a red light. There is a couple of there that are fatigue related, and so forth. So I just need to point out, so those figures don't look too high, but within those figures are some bad figures. These up here, and you'll look at it and go, gee, they're doing pretty bad there. But if you have a look at those, they are weather event related ones. Those ones. We're looking at roof strikes, hailstorms, and so forth. So these were in a very either drought or weather-related time frame. These particular ones here.
Okay.
So just moving on.
So this is the reality now.
This is the reality of what we're in at the moment. Now, this crash, again, not our fault. Our staff person was very lucky and was outside the vehicle at the time, and this vehicle was hit by a drunk driver. The driver obviously hit the rear of the car and then drove it up onto the footpath into a power pole. Happened in a suburban street at 1:30 in the afternoon in the middle of the week. So this is the reality of what we are dealing with at the moment. And I'll say this, that there are people out there making bad choices at the moment, and obviously having significant crashes which are affecting other drivers and so forth, pedestrians and push bikes as well. So this is what we need to educate our drivers to be aware of as well. You know, this crash was unavoidable by this driver. They were parking in a suburban street. There's no yellow line there. They were entitled to park there. They'd gone in to visit a client, and this is what happened. Very, very lucky our staff member was not in that car, because there would have been significant trauma.
What's your take-home thoughts? What lessons learned have any come out of it for a lesson learned, do you think, Mark?
The lesson learned for this one, Jerome, is exactly that. There are people in the community now who don't care about road safety and so forth, that are making very, very bad choices. But there are also people in the community that are carrying around, as I said, mental stresses, that when they are driving through, you know, they would normally pull up and give way, or they would normally slow down for a red light or something like that. But there are people out there that are not handling COVID-19 well, and the situations they're put into, and they are the ones that are doing careless things, or doing things that are impacting other drivers.
Mm.
And for us as a fleet, our responsibility is to make sure that we are helping our drivers to be safe drivers on the road if they are experiencing some of those mental stresses as well. Again, our drivers may have family that are in situations that they've never been in before.
Thank you so much for sharing that, Mark. Thank you.
So coming to traffic infringements, and this one is very, very clear. So COVID-19 lockdown, we travelled 2.4 million kilometres less in those 2 to 3 months. February, March, April. Okay. Then along comes May and June, when we start to get back on the road. Actually, that is June and July. Yes, sorry, I've got my months mixed up. So what happened then was our police force actually put more traffic cameras back on the road. But again, we put drivers back on the road that a lot of drivers back on the road that had been doing less driving, shall I say, and less services into the home than they had been. Okay, that had been doing less services and so forth. So we put them back under a normal environment, and what happened? Increased crashes, increased traffic infringements, increased red light infringements. So again, these were the triggers for the reset, the reset button. We had, I had meetings with our senior management. I pointed out the data to them. I said, we need to do a reset. We need some new strategies. We need to revisit some of our old strategies, but we need to get the message out there to our drivers. And that is continuing, by the way. We have not stopped. We've hit the reset, but we are actually bringing in new stuff as we go along. And we will continue to do so through COVID-19. We will not take our foot off the accelerator when it comes to road safety. Questions, Jerome?
Certainly do have a couple here. First one's a really good opening one. Do you capture mobile phone related instances, or those when drivers are pulled over?
That's a really, really good question. We investigate our crashes and we do have a look at mobile phones and try and identify, well, we don't try and identify, but we want to make sure that we have looked at the data on those phones and the calls on those phones, and to see whether or not only were they on the phone at the time of the incident, but leading up to it, were they spending time on the phone, which could lead to a compounding risk of distraction. That was the first part. Yeah, we look at that. With regard to pullover tickets and things like that, in the past we haven't had that. We now have, as of this week, advice from Queensland Transport if our vehicle has been pulled over and a driver has received an infringement.
Why don't you jump through and show us, Mark?
I'll jump through and show you the new notice, which I've got to commend Queensland Transport for. I think this is absolutely brilliant. And as a fleet manager, I'm so glad to see this. So I have redacted this one. However, this notice comes through. We'll see no action is required. This is a courtesy notice. The driver was pulled over. They were issued with a ticket. In the past, we have not had this data. So what we've only seen is what's been picked up by the cameras. We now see what gets picked up by roadside blitzers, by police patrols and so forth. So this will give us a better picture of our driver's performance. And yes, if a driver is seen on a mobile phone and the police pull over and issue a ticket, I'm assuming we will get that ticket. I have to check back with them to see whether or not they do pick up both mobile phone usage, and I hope I never see one, but if there was a drug test or something in relation to a vehicle, that we would get that if there was a person that tested positive. I hope I never see that. I hope we've got all the strategies in place that our staff are not those type of drivers, but you never know.
That's great. Another question here from Stuart. Do you find supervisors, managers are confidently able to have a conversation with a staff member who is involved in work-related driving incident? And are your supervisors, managers trained to have such post-incident discussions with their staff? And I think it's a really good one, drawing on after your crash.
It is a really, really good one. We have workplace health and safety get involved, right? So workplace health and safety does the investigation of the crashes and is also there to support the manager if a discussion is required. Depending on the severity of the infringement or crash will depend on who gets involved. Once a crash gets to a certain severity or an infringement goes to a certain level, then we escalate that where people and culture get involved as well. So for example, if a staff person was doing more than 30 kilometres over the speed limit, it's not something that is left exclusively to the manager. HR gets involved, as does workplace health and safety. All infringements and all trafficking crashes must be recorded in our risk management software, which is Riskman. And my staff, who actually send out the notices and who track the crash data, reconcile to Riskman every month to make sure that the manager has had the conversation and that recorded within Riskman are the interventions.
That's great. Thanks, Mark. I'm just mindful of time. I think we'll keep on rolling on, and then we'll ask a few questions towards the end. So this is going great. Thank you.
No worries. So, sorry, I'm a bit shaky on the mouse. My puppy has just jumped up and scratching my the things that happen at a webinar these days. So the COVID-19 journey, as I've explained, we hit the reset button. And really I wanted to, this today I think needed to be part of this presentation because all fleets must be experiencing issues, and if they're not, and I'll use the example for Victoria. Victoria is currently in lockdown. Every fleet in Victoria needs to be preparing for coming out of lockdown, because I can guarantee there will be crashes, and there will be significant crashes when Victorians all get back on the road. The same thing has happened in Queensland. So why the reset? There's that increased pressure on staff. Drivers that have not driven for 3 months. Mental fatigue across the driving community. They are all the reasons I've been talking about earlier. That is why we hit the reset button. The increased crashes and the increased traffic infringements was the evidence behind why we did that. So what did we review? We looked at everything, not just fatigue. We looked at the environmental risks, the increased roof strikes and the potential of significant weather events. So we've got Queensland's coming up into their wet season, the fire season starting. We are still seeing more roos on the road, even though we've come out of drought reasonably well. So we looked at that. We looked at reversing and parking infringements. And the reason we looked at that again was around driver mental fatigue, is that we needed to make sure that we were talking about all of the issues that the driver may be confronted with. But the whole time at the back of our mind was fatigue, 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 driver mental fatigue. We looked at journey management as a result of COVID-19 and the increased roof strike. So we had a reset on our JMPs, our journey management plan. So I had the guys, the workplace health and safety guys, do up templates, and we promoted those through email, through the workplace health and safety guys, but also through our social media posts. We had a relook at our driver education program, what we could deliver in service and what we could move to webinar. We looked at developing new videos, again with fleet strategy, a range of new videos that help to reinforce road safety. We looked at vehicle security, and sadly, there is an element within our community who are doing it tough and who may decide that stealing a vehicle is one of the options. And that's been reflected in a lot of the break and enters to steal keys that we've seen on the news in the last month or so. We looked at the reporting and the risk management. So again, we looked at resetting on everything, but we also made sure that we were recording in Riskman. We looked at amending our reporting, and also looked at changing how we were reporting to the executive and to the board.
Right.
And we had a complete redesign of the onboarding of all of our drivers. Now, this is a project we had been working on, but under COVID-19, we have escalated that or advanced that program.
It'd be great to hear the outcome of that, where that's at a bit later on, Mark.
Yeah, definitely.
So we can touch on in the future.
Yep.
Bleeding backwards. There we go. We're good to go.
Yeah, so look, this is one I just spoke about earlier. This has been a great collaboration. And I've got a story to share with you here. The guy in our IT department who helped me get these programs up is actually not at work at the moment. He's recovering from a motor vehicle crash. This guy was on driving to work 18 months ago. Back in January, back in January, he was driving to work on his motorbike. A lady came through an intersection on a mobile phone and took him out. He is now on 18 months recovery, physio 3 times a week. And I need to share that because I found a guy in our IT department who was passionate about road safety, and that was a win on its own. So within a very short time, we had set up Teams messaging to 4,500 devices. So those 4,500 devices are mobile phones and iPads in the field. So these are devices our staff use to do their case notes with their clients, and who are communicated with regard to the clients they have to visit and so forth, as well as our management teams across the entire organisation. So 4,500 devices. We're getting Teams messaging 3 times a week. We've now cut that back to 2 times a week this week, and we will scale back within 3 months to maybe once a week, but we will mix that up. They won't know whether it's coming through on a Monday or Tuesday or Wednesday or whatever. What we're trying to do is not get them to ignore a message when it comes through. So if I was to send this out 3 times a week forever, at 7:30 in the morning, they'll get that ding on the phone and they'll just ignore it and they just go, oh, it's just another road safety message. So
desensitize them.
Exactly right, Jerome. So we're very interested to see just what the outcome of this is going to be after even the first month. So and I'm more than happy to share the statistics on that through the Road Safety Partnership Program. The next big initiative that we rolled out last week, and that was our first road safety wallpaper. This went on to 2,500 computers, laptops, etc., across the entire organisation, to staff that just work in the office but just drive to work every day and home at the end of the day, to staff that use a laptop in the field and so forth. This is the first one. Lesson learnt with this one is don't put all your writing across the screen, because once you put a whole heap of icons and that on it, you lose the writing. However, the message got through. The next one we are designing will simply be a road safety message sitting up in the right-hand quarter of the screen. But again, positive feedback, a little bit of negative feedback from staff that said, I can't find my icons or I can't read the story. But again, fortunately, those people, well, I shouldn't say that, but again, these people were not people who would drive us on the road and so forth. These are people that accountants that sit in an office and so forth that might have, 60 or 70 icons on their desktop. So we learned our lesson with that one, but I think we're going to stop. I can take some negative negative comments, but as long as I'm getting the road safety message out to the greater workforce, that's what I want to achieve. This one is the new road safety videos that Fleet Strategy has been developing for me. These are whiteboard type videos, short, pretty powerful, and they're in a format that we can use both as social media posts, but also on social media posts, but also in our driver training sessions and so forth. So very happy with these, and we'll probably use this format for some other fleet management material that we are putting together.
And I'll thank you as well, Mark, for being willing to share these through the NSUP as well. And we'll be releasing our aggressive driving campaign in October, which is drawing on Tim's work as well. So keep your eye out for that one, mate.
Wonderful. Yeah, I'm looking forward to seeing that. And again, it's always good to collaborate with other people within the industry to develop these resources and so forth, and to be able to share. And again, you've seen the new infringement notice and so forth. So that, I think, is the end of that presentation, if there's any more questions.
We do have a few. We'll just try and squeeze these last few in before we close out. And so we'll just try and pump through them all. Talking to Tim, we have a great question from him. Is there any issue where social distancing limits vehicle occupancy, such as passengers, and means more vehicles on the road to deliver a service? And if so, how long are you going to balance that risk? That's from Tim.
Sorry, Jerome, could you just go through that one more time? The detail. Sure. Right, sorry, yeah.
Is there any issues where social distancing limits vehicle occupancy of such as passengers in a vehicle and means more vehicles on the road to deliver the service? And if so, how do you balance that risk and for how long?
Yeah, really good question. And what we have done, obviously we have very thorough cleaning instructions for our drivers. So all of our drivers, so I'm going to talk about the driver first though. All of our drivers clean obviously their hands and the surfaces between clients and between changing the vehicle over with another driver. So we have a process there. So they'll go into a house and whatever, they'll do the hand sanitizing, they'll come out and they'll wipe the surfaces over on the vehicle and so forth. Then they'll head off to the next client. So that's the process for sole workers and so forth. When we are transporting, so our buses, we have social distancing within the buses. We have increased the number of service and pickups with our clients that might be coming into respite care. So we have people, so where we might have carried 10 people in a bus, we're not carrying 10 people in a bus now. We might only be carrying 5 and they are distancing. They are then cleaning the bus down between each trip. So we've looked at it. We have to continue our services, but how we can effectively do that and keep people safe. Obviously, there are questions with regard to the health of a person. Our staff are not allowed to come to work if they are showing any signs whatsoever of an illness. They have to go to a doctor and be tested. We have a whole range of other strategies, I suppose, which I won't go in on. I'll just focus on the vehicle. But yes, we have social distancing within our vehicles, and we have cleaning regimes between clients and between changing over from drivers.
Great. I think we've got about 2 or 3 minutes left, so we'll see if we can squeeze the last sort of couple in. This one here is from Brian. Do you make drivers on international working visas get a Queensland driver's licence, or just let them drive on their own country's licence? Thoughts?
The answer is no. The new process that through the driver orientation and driver onboarding that I've put in place will require the drivers on international licensing, dependent on the country that they come from, to complete a assessment by our fleet driver trainers, FDT, or depending on the visa or the circumstances they're under to get a Queensland licence. This is a significant risk and one I think is an unacceptable risk in Australia. And I'm going to raise this in that on my driver's licence, if I have a medical condition that could impact my driving, so I might be an epileptic, I might have sleep apnea, I could have a physical disability, under Jet's law, I have to have that, or my doctor has an obligation to advise the Transport Department of that condition, and that condition gets put on a licence. Under an international licence, a person can come into this country and does not have that condition on their licence. That's an unacceptable risk for any fleet. And I think it's also an unacceptable risk for anyone coming into the country. I don't know what the solution is, but I think it's something our transport departments need to, and the Commonwealth need to address. Not a major issue at the moment because not many people coming into the country, but certainly it is an issue, and it's one that we've set up in our onboarding, but we've also set up that I will act as the fleet department will act as a gatekeeper to provide support to the manager when onboarding someone that is on an international license or on a work visa.
Great. Last question, actually two. Last question here from Caitlin. Do Uniting Care's staff have to transport patients, clients to different locations, e.g. hospitals as well? If so, what strategies do they use to manage patients who may be distracting while driving, such as disabilities, emotional trauma, those sort of things?
Yeah, that's a really good one. And we do, and we transport people from all over the state, and so we might have someone coming from Goondiwindi into Brisbane to the hospital for cancer treatment or post-surgery treatment or something like that, and we provide transport for those people. Again, we would obviously go through the normal COVID procedures and so forth, but those particular ones should have a journey management plan in place, and the drivers need to make sure that they are positioned in such a way that they are not distracted by that. I can't explain a couple of them for some reasons, but because we do provide children's services. But within the journey management planning, I have given advice where they should have 2 people in the car with the client, so that the other person is the person that can talk to with the client as opposed to the driver.
That's great advice.
There are some circumstances where you do need an additional person to remove the distraction.
Thanks, though, Mark. And I guess this last closing question here. Are there any emerging or current risks you think government should be addressing that would reduce risk for fleets on the road?
Yes. Okay. The international licensing is one definite one. And the other one is licensing related. One of the greatest risks for any fleet is knowing at any given time that your driver has a license. And what I worry about, and I worry about especially with COVID, is that there will be people out there that may have lost their license, but because they want their job, will drive unlicensed. We have processes where we manually check, but I would prefer that we would see an automated process where fleets can run a script through a website overnight and have automated emails coming in the morning if a driver has either had conditions put on a license or lost their license. That's probably one of the biggest things that I think our road authorities could do.
Make your life easier.
It would make life a lot easier because ultimately the responsibility of having a driver on the road unlicensed will sit with us. If that driver was to injure someone in a crash, then ultimately that could come back on the organisation for allowing an unlicensed driver to drive. And people will make wrong decisions going forward. There is a lot of people that have been impacted by work or lack of work or lost their jobs and so forth, or had a partner lose a job, and they may be the ones that lose their license and then make decisions that, that I will keep driving. And then there are those people who move house and don't advise the transport authorities and actually have their license expire. So an automated process will make it a lot simpler for us. But back to the international licenses, that's the big one for me.
Thanks, though, Mark. I think we'll call it. If you can just go to the last slide, please. And I want to say a big thank you to Mark for taking the time today, for being so open and sharing. As you can see, this is where you can go register and keep up to date. So please do sign up to our newsletter, social media links, and visit our website and be involved. Mark, thank you again so much.
Thanks, Jerome, and thank you everyone for signing in today to listen to this. And I hope you've all got some sort of a takeaway from it. And stay safe on the road, everybody.
Excellent. And our next webinar is in September. We're going to be exploring risk displacement, consider the need, or how to travel on the 17th of September, featuring Saul Jeevans. He's actually from the UK, and so he's calling in the middle of his night, and he's an expert in this space. So I hope you can really join us. Finally, thank you to our audience. This webinar and PowerPoint will be available on the website later today. And so until next time, as Mark said, travel safe. Thank you very much.